what is the role of a digital creative when it's about managing your online presence as a doctor? And how can you select the right team of digital creatives? So let's dive into the skill sets that are needed. Basically, the primary skill set that you would expect from your digital creative is the ability to organize your information. That's what it's all about. It's organizing your medical information about the treatments you offer, the procedures you perform, the conditions that you treat. So your web pages, they generate that precious Google visibility that you want. That is always the starting point. If someone's great at organizing your information, but you're not visible online, then how are you going to generate new patient leads? Now, that is a starting point. So being able to organize your information. And the way to do that is often based on, some guessing. Not here at Digital Practice. We don't guess, we investigate. So patient behavior research, that's what we call it. And on the left, you can see that what we actually investigate is the keywords that patients type into Google. So you would expect your digital creative not to just sit there and go, hey, I can design a great website. You would expect them to be able to organize your content on really elaborate content pages. And on the right, you can see how Google looks at these individual pages. It doesn't just look at what's visible on the screen. It just scrolls down and scans the whole page and evaluates those pages to make sure that what it shows to the patient who is doing a Google search is the most relevant result that it can generate. So that's the business Google is in. So you, as a doctor running your private practice, you can be served better by looking at digital creatives as your content creative, someone who's able to take your content and display it. And here at Digital Practice, we take that very seriously. So what we do is just keep track of the features of all the platforms. What can websites do? How does Google search work? How about social media platform? And making sure we select the features that help you generate more patients, not because it's the latest hype or because everybody else is doing it. So it's about selecting the features and the platforms and the tools that will help you build a better practice. Now, of course, here in Australia, we have AHPRA with these advertising guidelines for healthcare practitioners and healthcare professionals. So we want to make sure that every decision we make together is in line with those advertising guidelines. So that's in a nutshell how we look at those things. So what does this mean for you? Where can you start? And how can we upscale your online presence so you generate leads, so your leadership status is obvious, and when patients look at different websites and compare you to other doctors in your catchment area, they choose you. That's what this is all about. So there's a couple of things we can do for you and with you. One is assessing your current situation, your current website, your current profile, and giving you honest feedback in what is possibly there as a room for improvement. Secondly, we can start from scratch and build your website if you're just launching your private practice or you are revamping it, so we can help you with that. And we have ongoing marketing plans to make sure that new content is published to your profiles on a regular basis. Google loves that. Google needs it in order to keep ranking you high. So whatever your position, whatever the stage or the phase your practice is in, just book a free one-on-one strategy session and we'll be discussing your practice growth in the very near future. I look forward to that.